Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Tuesday, December 8th. We are joined today by Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpreter, Mary Thiessen, and André Boursier from French Language Services Directorate are also with us today. Following our speakers, we will go to the phone lines for questions from reporters, and we will call you by name, and you will each have 2 questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having a problem, please email ecoinfo@gov.yk.ca. Premier Silver?
Thank you very much, Pat. Hello, everybody, and thank you again for joining us here on the traditional territory of the Kwalin First Nation and the Ta'an Quechin Council. I'm very pleased to be here today with Mary and with Dr. Hanley for another update. We have had 10 cases, new cases, since our last week update, so there are now 10 active cases in the Yukon. As I have said before, we remain well prepared to deal with new cases. The team at Yukon's Communicable Disease Centre have done a terrific job, and they continue to do excellent work to keep Yukoners safe and informed. Contact tracing requires a distinct set of skills to ensure the proper information is determined when cases arise. I want to thank all of those at the YCDC for their terrific work that they've done for months now and continue to do. I want to remind Yukoners again, I might sound like a broken record, but the best thing that Yukoners can do is to support this ongoing effort is to practice the Safe 6+1. They are still the best things that you can do to keep everybody safe. Washing your hands, maintaining physical distance, staying at home when you're sick, traveling responsibly and respectfully, self-isolating as required, and following gathering guidelines that are in place, including limiting indoor gatherings to 10 people. By practicing the Safe 6, again, you are keeping all Yukoners safe, and I appreciate your efforts. Thank you. And remember, you now need to mask up when you are in public indoor spaces. Remember my simple advice, if you're not sure whether or not you're in what's considered a public space, wear a mask. Do it for your neighbors, do it for your friends, and do it for your colleagues. And I want to thank all of those who have been wearing masks in public. It's very great to see. It signals that you care about your fellow Yukoners and want to keep them safe. We are absolutely not out of the woods yet. Our government has extended the state of emergency for the Yukon. This extension follows the recommendations from Yukon's Chief Medical Officer of Health. The state of emergency was initially declared in the territory on March 27th, 2020, which seemed like years ago, in response to the COVID-19 pandemic. Under the state of emergency, we have been able to expedite a number of measures to mitigate the risk of importation and transmission of the virus and to support healthy, safe, and the health and safety and the economic well-being of Yukoners. Without the state of emergency, the ministerial orders that have been issued would expire. That would mean, for instance, that we would no longer have border controls, that we would no longer have the self-isolation requirements for those entering the territory, and we would no longer have enforcement of the health and safety measures in place to protect Yukoners. It's important to note that extending the state of emergency does not indicate any change in the risk of COVID-19 to Yukoners. The state of emergency may be cancelled at any time, though our government believes it may be required so long as the pandemic continues to pose a risk to the health, the safety, and the livelihood of Yukoners. We evaluate the need for the state of emergency on a monthly basis. We also regularly evaluate the state of emergency, the ministerial orders issued under the Civil Emergency Measures Act, and will repeal any that are no longer necessary to the current pandemic situation. As long as the state of emergency is active, we can adapt and react quickly as a government to the impacts of the pandemic. These measures remain important while we wait for an effective treatment of COVID-19. I know that there's an awful lot of interest in potential vaccines as the news pours in about candidate vaccines and approvals. Planning for a vaccine is well underway. Our government has teams working on the distribution and storage concerns as well as allocation. Obviously, these details are still being finalized. Right now, Canada does not have an approved vaccine. We know that we are close, but the approval has not been given yet. That means that plans must be fluid to account for different realities of the different vaccine options. Now, the Deputy Ministers of Health across the country have met to discuss vaccine plans last week. Minister Frost also met with her federal, provincial, territorial colleagues last week. Later this week, I will meet with my fellow premiers and Prime Minister. We continue to stress with our federal counterparts the importance of fair and equitable access to vaccines, including for key populations that are high risk, such as long-term care residents, elder populations, immune-compromised individuals, healthcare workers, and Indigenous, remote, and northern communities. The discussions have been going very well, and I am cautiously optimistic about my meetings later on this week. Once again, when we get confirmation on the types of vaccine that will be distributed in the North, the number of doses and the date of delivery, we will be ready to share our plan for a vaccination rollout. Health officials have been preparing for a vaccine plan for the territory. This includes identifying storage space, the number of required doses, staffing requirements, and plans for distribution. We are determining key populations for initial immunization, which includes high-risk and immunocompromised individuals, elders, healthcare professionals, and Yukoners living in rural communities. A National Operations Centre is being established to coordinate the logistics and distribution of vaccines, and the Canadian Armed Forces is helping with planning, data sharing, and supporting Indigenous and rural communities. Yukon's Emergency Measures Organization is working with the Joint Task Force North to build planning capacity for distribution in the North. We anticipate approved vaccines to be available in early 2021. We will continue to share information as soon as it comes available. I encourage all Yukoners to be patient, continuing to practice the Safe Six and wearing the masks. Yukoners should also keep in mind that the vaccine will be a turning point. It will not be the end of COVID safety precautions right away. We cannot let our guard down. We must remain vigilant. As of this week, restaurants and bars are now required to collect the contact information for patrons. This is being done in order to help the team at YCDC with contact tracing in the event of a positive COVID-19 case. Now, it doesn't mean that the restaurants or bars have done anything wrong. Quite the opposite. Our bars and restaurants have been doing a great job of adapting to the pandemic and providing a safe and sanitized environment for Yukoners to enjoy quality food and drinks. I want to thank the bars and the restaurants for all of their work, all of their efforts to preserve ourselves and to keep us through this pandemic, and for their cooperation in these new efforts to support contact tracing. I encourage all Yukoners to be respectful of the request for contact information when they go into a bar or restaurant. Again, it's about keeping Yukoners safe. This is extremely important, and it will help protect Yukoners. We are all in this together, and we will get through this together. With the holidays approaching, we know that some Yukoners are planning to host gatherings and guests from outside the territory. A student returning from university, perhaps, or a grandparent who might otherwise be spending the season alone. We also know that you would do anything to share a meal or a hug with your guests. As such, we have worked to establish a self-isolation option that lets you do both, but you will have to commit to self-isolating with them. That means following all the regular self-isolation rules by staying at home, only going outside alone or with people that you are self-isolating with, and not having visitors. If your guest leaves before 14 days, your entire household will need to continue to self-isolate for 3 days following their departure. and monitor for symptoms. After those 3 days, if everyone in your household and your departed guests do not have symptoms, you are free to leave your self-isolation. We know that many of you will be wondering, why only 3 days? I want to assure you that these guidelines are based on science and are recommended by our Chief Medical Officer of Health. People with COVID-19 may be infectious for up to 3 days before they start exhibiting symptoms. So, if your guest leaves and develops symptoms within those 3 days, they could have been spreading COVID-19 to you and the rest of your household. When this is the case, you and everyone in your household will need to continue to self-isolate for the full 14 days from your guest's departure. However, if your guest does not develop symptoms within those 3 days of leaving, that means that they were not infectious while in the Yukon, and you may carry on with your day-to-day life. If you're hosting somebody from outside the territory but do not want to self-isolate with your guest, you must follow all of the self-isolation option 2 guidelines on yukon.ca. This means staying 2 meters apart or 6 feet from anyone that is self-isolating in your household, using a separate bathroom if possible, washing your hands often, and cleaning household items regularly. We are confident that these self-isolation options will allow Yukoners to connect with their loved ones this holiday season while still keeping our communities safe from COVID-19. Now, I know that this is a lot to digest as far as those 2 options, but please, if you have more questions or concerns, there's information available on yukon.ca. And remember, again, the message that we've been sending out for months now, and will continue: be kind, be patient, and be respectful with one another. Thank you very much. Merci cho, merci beaucoup. Dr. Hanley.
Merci, Premier Silver. Good morning, bonjour tout le monde. I'm going to try to be a little shorter with my update today, but there are a few points I want to make sure I address. I want to again reiterate the importance of staying home if you're sick. And I want to make sure that the people that you're spending time with in social settings is kept to a minimum. And I want to, again, go over some of the changes regarding bars and restaurants. First, though, a little more on outbreaks. And over the past several weeks, you've heard me say that we're dealing with 1 or more outbreaks of COVID-19. And I wanted to use some time today to explain what this means for Yukon and how Yukoners are affected by these outbreaks. An outbreak is simply what happens when we see a sudden increase in cases. So first, I want to be clear that an outbreak is not necessarily community transmission. It's just the term that we use when there's a substantial, rapid rise in cases. Now, our case count at present is up to 58 cases as of today, and due to some recoveries, we now have 10 cases considered active within the territory. Only one of these cases is outside Whitehorse, and that's the last one, number 58. This case, however, is linked to the Whitehorse outbreak. The individual was a known contact and already self-isolating safely, and thus there is no risk to the public in the community associated with this recent case. Most of these cases, therefore, have direct links to the ongoing outbreaks or are related to out-of-territory travel. I am encouraged that the rate of new cases is slowing and that most of the recent cases are occurring amongst known contacts who were already self-isolating. We're seeing very few cases associated also with any of our public notifications. However, as we continue to investigate the source of origin for some, we cannot rule out community transmission at this time. I expect we will continue to see new cases emerge amongst contacts of cases to date. This is normal until we can identify and isolate the last people in the chain of transmission. I am working on a more detailed summary of cases that I will come back and share with you. But meanwhile, let me take a bit of time to explain how an outbreak happens. So, someone travels out of territory, And while under self-isolation, for whatever reason, contact with someone else occurs before the end of that isolation period. Or perhaps that person is a frequent traveler for critical work and inadvertently picks up COVID infection outside. Now, let's say that before symptoms develop, this person goes to the grocery store and then grabs a drink with some friends at a small get-together. A day or two later, a slight cough and sore throat begins. The person thinks they're just overtired. She spends a few hours at the office the next day, but as symptoms worsens, decides to call it a day. They stop at the COVID testing and assessment center on the way home, and they're called 2 days later with a positive test. So, now where do we have exposure to COVID? Well, we have the store and the get-together at somebody's house. Equally, that gathering could have been at a bar or restaurant. And we also have the place of work. So when it's found that he spent 45 minutes shopping, the grocery store is named as a place where the public may have been exposed. He identifies his friends as contacts. They are called by YCDC, and as close contacts, they are asked to self-isolate. A week later, 2 of them develop symptoms, are tested, and 2 new cases are confirmed. Meanwhile, the workplace is assessed. It turns out that there was a lengthy meeting in the conference room where several people were sitting close together without wearing masks. Ventilation was noted to be poor, and the cold air meant the windows stayed closed. Due to the high risk, these people are all sent home to self-isolate. 2 develop symptoms 4 days later, are tested, and become positive. You get the idea. Now, as long as we can trace and find all the contacts, the outbreak can be contained. But what if there are other exposures that were not identified? Or perhaps many people exposed at one setting, say a large indoor gathering, or if there were multiple contacts over a few days in various settings. Any of these could set off enough threads of infection within a community that cases will start to appear in various places that are no longer traceable to the original case or to known contacts of a case. You see then how quickly we can change from an area with no active cases to a surge in cases. Our goal right now is to get us back into containment mode through contact tracing, ample testing, and continued vigilant practice of the Safe 6+1. And we can get back there. The next 2 weeks will be telling for us to see if we can get back on top of this challenging COVID infection. I know I spoke at length during last week's update, so I'd like to reiterate a few points that may have been missed. And these points are mainly about what we need to do between now and the end of this last month of the year. What precautions should we be taking to minimize our risk? First, stay home when you're sick. It's your personal responsibility to isolate yourself from others when you're feeling ill. You must not go to work, or school, or run errands, or go to the gym. We need to ensure that we are protecting other Yukoners. Staying home while sick can help us accomplish this. A quick story. Last week, I received the most wonderful video from the Gardens Early Learning Center in Whitehorse. And thank you so much to the kids and their caregivers for assembling the words of gratitude, but also for the sound advice. And one little child said it better than I could. If you stay sick, stay in bed. Or at least, you must stay away from work, self-isolate, and arrange for either a test or if for whatever reason you can't make it to get tested, then you must self-isolate for 10 days. Second area is about working from home if you can. And we're not asking services to close their doors or to shut down. We want services to continue to run, clients to continue to get the service and care that they need. This is not the old days of March. But if we can reduce the number of people in workplaces while still carrying out all the businesses and services, we will reduce the chances of outbreaks or transmission within the workplace. For employers, please consider ways that you can support having some employees work from home where possible. If you feel you're unable to support this as an employer, please refer to yukon.ca for all pandemic relief supports. The third area is keeping to your social bubble. Social bubble guidelines did relax a little bit with our Phase 3 Path Forward plan in the summer, and that was a very welcome change when the 2-household bubble was allowed. But some of us have taken that a little too far. As we enjoyed week after week without cases, we know that many of us have mingled with larger groups of friends or allowed people outside our bubble regularly into our households on multiple occasions without adequate spacing or even attention to numbers. That's easy to understand. But right now we must revert to strict guidelines on maintaining a consistent social bubble. And as a reminder, a social bubble means the following. It begins with the people that you live with. So family members, including children, your roommates, your partner. And now add to that someone else who might regularly come into the household. Perhaps another family that you're close to, another parent to your child or children that lives outside of the home. Perhaps a neighbor with similarly aged children. I know we have said up to 10 to 15 people, and that is a maximum. So that should include everyone you live with, whether roommates, parents, partners, or children, plus the other selected group, whether neighbors or close family friends. Whether one household or two, when you reach 10 people, you are approaching the limit. Now, if you do want to socialize with people who are outside your social bubble, keep those visitors outside or well spaced in a setting that allows for spacing to occur, whether that's outside in a public space or at an organized gathering. I'm asking all of you to stay consistent with your social bubble. We need to minimize our number of contacts to ensure that we're protecting ourselves, our loved ones, our friends, our colleagues, and our elders. To prepare for the weeks and months ahead, as well as a possible sustained increase in COVID activity, my team and I have begun to revisit our guidelines and seek where we can to adjust them according to our present assessment of COVID risk. As always, our goal is to anticipate risk and to have measures in place that are proportionate to the risk to the public. We are preparing further recommendations for government to consider for public health measures should the COVID situation become worse. Although our bars and restaurants all around Yukon have been exemplary in their compliance with and promotion of COVID-safe measures, we know that the potential for transmission of COVID is always there. Therefore, to reduce our risk at bars and restaurants, as of December 7th, we have implemented a sign-in sheet required for all bars and restaurants. If you are going to enjoy a drink with someone in your social bubble, or going out for a family dinner at one of our many wonderful restaurants, you or someone in your household will need to sign in with their name and contact information. I'm asking that all food and drink establishments collect patrons' contact information before allowing them to sit down in a restaurant. Of course, we have been dealing with an increase in cases, and we have seen the demands that a sudden increase places on our public health nurses as they carry out contact tracing. We need to be as prepared as we can for further surges in case activity, or perhaps a widespread outbreak. In the case that we have one or more cases involving potential exposure at a restaurant or bar or pub, we want to ensure that all the patrons who are in close contact can easily be found and advised on what they need to do. Contact tracing is imperative in helping us manage ongoing cases and prevent cases from becoming outbreaks, outbreaks from becoming more and more widespread. The more information we can easily retrieve from establishments that are notified as locations of exposure, the better equipped we are to identify patrons who may be at a higher risk of exposure. As the holidays approach, one thing that has been on my mind is people going out to restaurants and bars to celebrate the holiday season and cheers for the new year. We know that bars and restaurants can be higher risk areas of transmission, as it is an indoor setting where the public are able to mix. Now, as people drink alcohol, their level of awareness may decrease, leading perhaps to a lack of physical distancing, hugging people who are not part of the social bubble, not correctly wearing masks. Any of these actions can increase an individual's risk of contracting the virus. I hope that anyone who is going to a restaurant or a bar listens to the staff and management, and I know these establishments are doing everything in their power to keep you safe. And if they ask you to remain at your table, please remember they're directing you to do so with your best interest in mind. We need to take proactive measures as we continue to navigate our way through this pandemic. Providing your contact information before you sit down at a restaurant is one small thing we can do that can have a big impact. So remember some of today's takeaways. Stay home if you're sick. Reduce your contacts and keep that bubble to 10 to 15. And the closer to 10, the better. Be prepared for further public health measures should COVID activity continue or should we see signs of community transmission. Always remember the safe 6+1 and use your mask. And always, as the Premier said, always remember we're all together in this pandemic and we need to be kind to each other and understanding of what each of us is going through. That's all for my update. Thank you. Remember to take care of each other. Stay well. Merci, Cho. Merci.
Thank you, Premier Silver. Thank you, Dr. Hanley. We'll now go to the phone lines, and we'll start with Philippe from CBC.
Yes, thank you. Dr. Hanley, could you tell us a bit more about why 3 days is the chosen number after a person would have a guest leave? How did you arrive at that number rather than, say, a longer isolation?
Yeah, thanks, Philippe. And I actually thought the Premier explained it very well. It really relates to the infectious period. So remember, I was saying last week that when a case becomes symptomatic, so let's say you're exposed, you incubate the infection, and then symptoms begin, usually with a cough or potentially a mix of other symptoms, but that sort of cough, fever, shortness of breath, the person can still be infectious up to 2.5 to 3 days before the onset of symptoms. So the reason we focus on 3 days is that pre-symptomatic period where the person could have been infectious. So let's say a student is a student with a Yukon family is coming back from university in Ottawa and coming for 5 days over Christmas and staying with the family here, and then but let's say was exposed to COVID and during that 5 days is incubating COVID infection, and then leaves after 5 days, but 4 days after leaving becomes symptomatic. Say a cough and a fever begin. So in some ways, even though the COVID was incubating and has developed 4 days after leaving, that infectious period has been passed. So we can conclude, because of that 4-day onset, that 4-day period, that the student was not infectious during the time he or she was staying with the family in Yukon. So whereas if it had been, let's say the person leaves and the next day after leaving, on the way back, develops a cough and fever, then we can conclude that the person was infectious while in Yukon. And therefore, so it's really that whole kind of pre-symptomatic period that determines our advice. Hope that's more clear. I know we think of 10 days and 14 days and 3 days and what's the reason for all this, but really it's based on that 3-day potential for transmission of disease in that pre-symptomatic period.
Thank you. Do you have a follow-up, Philippe?
Yes, thank you for clarifying that point. I wonder if a person is wearing a mask in a public space, does this make it less likely there will be a public exposure notice?
Yeah, that's a really good question. And so let me say it factors into the risk assessment, but it's not a hard and fast rule. So it may be in those sort of more borderline cases where it seems that all the right measures were carried out, plus a mask was in place. It might give us that extra confidence in the risk assessment, but in and of itself, we do not consider it sufficient protection to sort of clear a contact, because there are just so many individual circumstances that might play into that we will not know. You know, was the mask worn properly? What type of mask was it? So there are all of those considerations that really make it not very reliable, but sometimes it certainly provides us sometimes that extra degree of assurance that attention was paid to all the right measures. And I think it goes back to the importance of mask use is as a population measure, that if enough people, like 90 or 95% of people are wearing a mask, we know that has the potential to substantially reduce transmission in the population, in the community, even though if you look at each individual interaction, it's harder to determine at that individual level.
Thank you. We'll move to Tim from Whitehorse Star.
Yes, hello. First question would be is for Dr. Hanley. Do you have any plans to try to lobby or put pressure on federal officials to get the vaccine here earlier into the Yukon?
Yeah, no, I don't. Of course, the Premier and I have been in discussion a lot. I am in very frequent and quite intense conversation with my colleagues around the country, with the Public Health Agency. So we are hoping to be able to clarify plans as far as products and availability, as the Premier said, even before the end of this week. So I'm actually not particularly worried, and again, I think it's important that this early release of the Pfizer product is intended as a kind of a dry run in a way. Of course, it's a welcome, very welcome release for a limited with a limited supply going to these population centres around Canada. We haven't been particularly lobbying for the Pfizer product because of the logistical considerations. So what I'm glad to see that the campaign is beginning to roll out in the UK, that we're looking forward to doses coming. We're looking forward, we think very soon, to the Health Canada approvals of not just the Pfizer but the Moderna product, which is the next in line. And I think we're going to have, I'm hoping, a lot more to tell before the end of the week.
Do you have a follow-up question, Tim?
Yes, I do. Since the Canadian military is involved in the vaccine distributions in this, what you're calling a trial of the Pfizer vaccine, is there any reason why some of those ultra-deep cold freezers couldn't be flown north for us to try?
Yeah, there are a few reasons. One is, again, this is a very, when you look at the population of Canada, this is a very limited release. The Pfizer vaccine really is designed for large population areas. It is not. It's not just a question of the freezers. It's all of the mechanisms of that are involved in storage and transport. And an example is that the Pfizer vaccine is not designed for onward travel, so it actually has to be delivered to the point of administration. The second thing is that the minimal number of doses at a time is 975. So you have to have basically 1,000 people ready, which clearly is not a realistic option for our communities. And we don't want to waste any dosing. So again, more to come on which products and with what schedule, and those details will come very soon. I am not at all concerned about this first lot of vaccine coming to those designated population centers around the country. And in fact, I'm very excited to see this happening so fast.
Premier Silver?
Yeah, I would just add to that that this is exciting news. If you went back even a month ago, the timelines of when any type of vaccine could be available for distribution was all in January. So again, in very short time frame, what we've seen is an expedited advance of a test of a particular vaccine, which is great news for everybody, including Yukoners. The bigger story is that we are still on track for the 6 million doses that have been also announced from the federal government in the first quarter. So great news from the Prime Minister about several 100,000 doses of the COVID-19 vaccine to be available in Canada by the end of the year. Very happy to hear that this rollout is moving forward. We are having conversations with the federal government this week, including a call with the Prime Minister. While no vaccines have been approved yet by Health Canada, we are expecting to have information on vaccine availability and distribution for Yukoners within this week.
Thank you. We'll move now to Haley, Yukon News.
Thank you. I had a question. We've had reports of some employees being instructed by their employers not to visit public exposure locations, or staff with 2 jobs being told that they have to choose one. I'm wondering if you have any instruction for employers who are trying to deal with that and trying to alleviate anxieties in the office if they have more than one job.
I can start. Again, the guidelines do change, and they've been changing over the last 9 months of us in this situation. We urge folks, if they have any confusion, there's helplines to call as far as what the guidelines are, but also what supports are available for people that, for whatever reason, due to COVID, cannot be at work. So I don't know the case that you're talking about specifically. I'm sure that the departments are working on responses to individual cases as they come up. But again, if an individual has questions, there's the lines you can call on yukon.ca. The guidelines are all up there as well as a link to all of the provisions that the government has for folks that are dealing with COVID and in a work situation.
Yeah, and I want to add to that. Thanks, Premier. This certainly is not based on any direction from our office, and I think again, I think we have to go back to the reasons that we put out the exposure notifications. Hopefully, for everyone to be clear about, it's that there was a potential for exposure between a case and members of the public at a particular location at a particular time. It does not say anything about ongoing transmission risk. If there are concerns about ongoing transmission risk or the suitability of a particular place to be open, then it won't be open. If it's open, it's good to go, and we should be patronizing our local businesses like we always do. So we're talking about a moment in time when public transmission occurred. So it's the time plus the place. That is the really important part to take home. And it does not say anything about an ongoing risk or a need to stay away from that place. It's quite the contrary. And yeah, I think that direction about not working in two places at once is not based on any guidance from our office.
Thank you. Haley, do you have a follow-up?
I do. Yeah, thanks very much for that answer. I was wondering, case 58, the case outside of Whitehorse right now, can you tell us where that case is? And if not, could you just provide an explanation for why that information isn't being made public?
Yeah, thanks. And this is maybe a chance to talk about how we do our best to protect confidentiality of cases, whatever case that is, whether it's case number 1 or case number 58. And we do everything in our power to protect confidentiality of the case, the family of the case, and the community of the case. That's not a realistic, perhaps, a direction for cases that are based in Whitehorse. We recognize that there's enough, Whitehorse is big enough that there's enough anonymity that we can comfortably announce cases that are Whitehorse. And that's where we kind of draw the line, Whitehorse and between Whitehorse and non-Whitehorse. This is not specific to COVID. This is our communicable disease policy, always has been. And so if we have cases of tuberculosis, for instance, we do not disclose origin of cases of tuberculosis. What we do communicate is risk. So if there are areas or regions or districts of risk, then that is the reason to provide that public notice. So therefore, if there's an establishment, such as in our previous public notifications, as you know, they have included more recently Dawson and Watson Lake when we have posted public notifications. So clearly then we're identifying a community associated with a case because there's a potential public exposure. But otherwise we don't. It's about communicating risk and protecting individuals. And time again, we have heard back from either families or communities or leaders, chiefs, mayors, about how much they appreciate that protection of confidentiality. I always make a point of having direct conversations with leaders in the community affected, as I have done for this case as well.
Thank you. We'll move now to Marine Aurore-Boréal.
Oui, merci. C'est une question pour le docteur Hanley. Pouvez-vous nous répéter en français ce que vous avez dit au sujet du vaccin? Où en sommes-nous au Yukon par rapport au vaccin?
So, Dr. Hanley, could you please repeat in French where we are in terms of vaccines and what are the next steps in vaccination?
Oui, merci pour la question. La question sur le vaccin, on est au point d'être dans une position d'annoncer beaucoup plus avant la fin de cette semaine. Donc, ça dépend dans les décisions et des annonces fédérales et aussi des approbations des produits, des vaccins. Les deux vaccins qui sont présentement sur la table, effectivement, le produit Pfizer et Moderna. Donc, il faut patienter quelques jours en plus pour avoir plus d'informations. En même temps, je suis très confiant qu'on va, on n'est pas oublié. On est toujours en conversation avec nos collègues autour du pays et nos collègues fédéraux. Et on sait que les besoins des communautés du Nord sont bien considérés avec les prochaines étapes pour la distribution du vaccin.
Merci. Avez-vous une autre question, Marine?
Non, merci.
We'll move to Claudia, Radio-Canada.
Oui, pour le docteur Hanley, les derniers cas qui ont été annoncés hier dataient de vendredi et samedi. Pourquoi attendre au lundi? Puis j'ai vérifié le site web toute la fin de semaine, ça n'avait pas été mis à jour aussi avant de mettre à jour le nombre de cas.
So the last few cases happened on Friday and Saturday, but the information was not made available until Monday. Is there any reason for the delay into announcing these cases?
Oui, merci. Et peut-être c'est une chance pour clarifier que depuis au moins quelques semaines, sinon mois, on a fait la décision de pas annoncer les cas pendant un week-end et de faire des updates de cas pendant la semaine. Et c'est juste que ce qu'on veut concentrer non seulement sur le nombre de cas, mais le risque du public. Donc, si le risque ne change pas, s'il n'y a pas un besoin de faire une notification publique pour un exposé au public, donc c'est juste une question de le nombre. Et si le nombre change entre 54 et 57 ou 58, ça change pas le risque pour le public. Et donc, c'est vraiment de concentrer sur les besoins plus immédiat de faire tous les affaires pendant le week-end sur l'investigation des cas de dépistage, de tout ce qu'il faut pour la machine de continuer et pas pour être diverti par les besoins de faire une communication.
May I ask you to repeat that in English, please?
Sure. The question about why we're not announcing cases on weekend, and this has been a decision actually in place for some time, and the reason we've seen more weekend announcements recently has been because of public notifications. So again, what I have asked my team to concentrate on is communicating risk and not communicating sheer numbers of cases. So if the risk to the public between 54 and 57 cases hasn't changed, then I look forward to the next regular update of cases, which would be the Monday following. So really, we're doing a lot through weekends. We're doing a lot just to concentrate on where we really need to put the emphasis, whether that's allowing our team to continue their investigating the cases, the contact tracing, the testing, and not getting diverted by what I see as unnecessary communication efforts.
Thank you. Une autre question, Claudiane?
Oui, ben toujours sur la même question. Est-ce que les nombres à ce moment-là sont communiqués aux autorités fédérales, aux autorités nationales, ou si c'est juste pas communiqué localement? Où est-ce que vont les chiffres quand on a un nouveau cas pendant la fin de semaine?
So are the new numbers happening during the week and communicated to your colleagues elsewhere or to the federal authorities, or are they just not communicated to anybody and waiting for the beginning of the next week?
Le rapportage, c'est direct entre le centre de maladies communicales et le YCDC et l'agence fédérale de santé publique. Mais le rythme de communication, en fait, je suis pas au courant et je reviendrai avec cette information. Je crois que c'est pas forcément rapporté pendant le week-end, mais c'est un procès internal entre la juridiction locale et fédérale. Donc, I'll just repeat it. Yeah, I'm not entirely sure of the process for communication between YCDC and the federal agency, the public health agency, how the rhythm of the reporting of cases. I believe it does not occur through a weekend, but there's an established protocol. So I'll come back with that information.
Thank you. We'll move now to Laura from CBC.
Oh, hi there. Yeah, Dr. Hanley, just following up on my colleague's question, I know other regions update their COVID case numbers consistently at the same time every day, or as soon as they find out about a case. I know you've talked before about wanting to communicate risk and not wanting to cause fear before doing contact tracing. But are you concerned at all that not providing consistent updates can cause rumors or even downplay the seriousness of the pandemic in Yukon?
Well, I guess all I can say is, we'll take anything under advisement and reconsider our approach. And if I think it's important though that I've seen in other places how too much of a focus on numbers can divert from some of the real principles of where we're seeing risk, and recognizing, especially in places where the number of confirmed cases may actually not represent what the actual activity is, and therefore what the public risk is. So I do think that there is not always necessarily a tight connection between numbers of cases and public risk. And that's why always we've tried to communicate that there is a risk, even when we don't have confirmed cases. There's that risk of unrecognized introduction of cases, unrecognized transmission. And that's whether we had stayed with the 15 cases that we were in July, or we're at 58 and counting as we are now. That is I think that is the essential part, is to recognize that there is that risk, and the risk doesn't in itself change whether we have 15 cases or 58 cases. It's that risk of unrecognized transmission. I think that's the part I've been trying to emphasize, and any communication requires sometimes further communication, further explanation, and we're always trying to reach that right balance of making sure that numbers are available, that there's a transparency to the process, but also I have found that sometimes our efforts at communication can be a diversion from some of the core work that we do. So happy to take another look at this and relook it with our team on the best way to make sure that current information is available, but as always, my risk is on my emphasis is on the best way to communicate risk.
Thank you. Follow up, Laura?
Yes, thank you. I know there's going to be more details coming out later this week about the vaccine rollout, but I'm wondering if when you're looking at priority groups, if teachers and educators are included in those discussions of being a priority for the vaccine.
Everyone is included in the priority list, and if we were to be looking at priorities on the sort of the first day, as it were, or the first week, it's where do we need the protections first. So clearly we have we want to preserve our workforces and our essential and critical workforces. But we look at the priorities from both an individual clinical protection point of view, but also a maintenance of provision of service point of view. The North as a whole is actually a priority population and has been recognized as such by the federal government and by the Prime Minister. And so that's one important thing to note, that we as a territory are actually identified as a priority population. Our Indigenous peoples are a priority population. Our healthcare workers are a priority population. And our seniors and our elderly populations, particularly those in long-term care, are a priority population. So many of us fall into priority populations, and this is all part of that consideration. And again, I think there'll be more clarity, not just to the products and timelines, but to how we are addressing the priorities within our own territory as a priority population, again, in days to come.
Premier Silver?
Yeah, I concur with everything that Dr. Hanley just said. The only thing that I would add is once we find out the dates, the quantities, those two variables really do weigh on prioritization as well. So as Dr. Hanley spoke, Trudeau has already recognized the North as being a priority. When we get more information about what type of vaccine we get, when we get it, and how we're getting it distributed, that will be the missing pieces of us being able to communicate to Yukoners and to the nation of how we are going to roll out that vaccine.
Thank you. And we'll move now to John from CKRW.
Hi. This is for whomever is best to answer. I'm wondering how the mask mandate is going in the territory. Has the government noticed any pushback or had any issues or had to issue any fines?
Premier?
So I'm not sure about any fines. I haven't heard of any fines yet for masks. I don't think we have. I think the rollout is going as well as could be expected. I appreciate Dr. Hanley's dealing with this as far as the recommendation goes, and the main part of that being acceptance, public acceptance. And I really believe that we hit an apex of that. You know, it was good timing where we saw most Yukoners wearing masks. We heard municipalities and other businesses, you know, pushing for mandatory masks and those types of things. So it was really good timing. We spent the time, we announced as quickly as possible and then gave folks time to prepare. You know, I'm kind of, you know, in my social circle, which is very limited these days to people in the Legislative Assembly, I haven't been hearing very much pushback as far as people refusing. And I do appreciate when Minister Stryker rose to his feet in the ledge and talked about how, you know, it's about informing. You know, like what we're interested right now is making sure that people have the most up-to-date information about the requirements and hoping that information is going to be key so that we don't have to use the heavy stick of fines.
Yeah, and thanks. I agree with everything the Premier said, and I just wanted to add that we, you know, as with any of these new orders that have come into place over the past few months, there's always a catch-up component because I know that there are many questions still that people have, and some questions about how does the exemption process work? Do I need a medical note? Maybe more specifics about where and where not it's required, and what about within the workplace? So we are compiling and developing a bit of a guide to address many of those individual questions that we've seen coming through. So that's what I've seen sort of is just a number of sort of individual circumstances which I think over time will work out. Sometimes it's details that we hadn't even thought of. Sometimes it's just clarifying what's already been written in the orders. So I think more clarity with more time, more comfort with time. I have not myself either heard of any pushback or significant complaint or around the actual order itself.
Follow up, John?
Yes, thank you. I'm also wondering, you earlier said the territory will continue to take proactive measures. Has the government considered instituting a 2-week lockdown and just extinguishing any ongoing outbreaks while also eliminating the chance of spread? It's been proven from other countries around the world that it can be done to reach 0 cases.
Premier Silver?
Yeah, I can start. I'm sure Dr. Hanley would have something to say as well. You know, I think in our path forward, the plan through COVID, we've been very clear about the triggers that would trigger us into a situation where we would have to move forward or backwards. And I have complete faith in Dr. Hanley and his team in monitoring the epidemiology and the situations not only here but in our neighboring territories and provinces and the state of Alaska. And also very confident in that the measures that we've taken so far are really a good balance where we acknowledge the need, especially during the holiday seasons, for us to be with family and to be as safe as possible. And it is a fine balance. And I'm so glad that we have the Chief Medical Officer and his team guiding us through the requirements and the recommendations and the guidelines coming from his office, because we've done a good job. And you take a look at comparisons to the rest of Canada, we are in a good place right now. You're never going to close down the border. Our supply chain management is always going to be there, and so there always will be risk, even if we do have a quote-unquote lockdown, to use your words, John. So I think there's very limited traffic right now. Minister Stryker has reported on the reduction of traffic that we've seen into November and then into December, and we will continue to monitor the situation. But as far as a complete lockdown, it would be very hard to do a complete lockdown. It's not something we want to do. What we want to do is maintain the safe six. And I know people have asked Dr. Hanley this in the past, as far as what keeps him up at night. Throughout the months, I think he's been asked that question on a very, very regular basis, and I'd be very surprised to hear him not say, we're getting into the holiday season now more than ever. Yukoners will be the ones to help us reduce the spread by maintaining the safe six. That's what we can do to lock down this virus, is to do our social responsibility each and every one of us while we monitor the triggers, the 6 triggers that would trigger us forward or backwards. And as everybody's looking at one trigger forward of a vaccine, I think the thing that keeps myself and Brennan up at night is we need to get there, and we need to get there safely. And we heard the health minister of Quebec say today and yesterday very profoundly, there are folks that won't be around from now till when the vaccine hits, because the virus is still spreading throughout Canada. So we really need people to be patient and be vigilant now more than ever, as we know that good news is on the horizon for Yukoners and vaccines.
Thank you. Dr. Hanley?
Hey, have you got an hour?
No, you just got a few minutes.
Okay, it's a great question. Thanks for the question. And for one thing, there's no definition of lockdown. So even to think of what does a lockdown actually mean, you could probably define it 20 or 25 ways. But I think I know what you mean. Everyone stay in their house. We basically shut down society for 2 weeks, and what would that do? But what that would do is it would be devastating. And so again, I think it's always having a proportionate response is really the key to managing our population, managing our collective mental health, managing our ability to thrive and survive as a society, while having appropriate and what I said earlier, I think proportionate responses. So it's always that dance. And I think what we've shown in the last couple of weeks here is that we are able to see what's going on and translate that into information and recommendations that we provide back to feed into further measures. So an example is the workplace situation. We have seen through this recent case activity, we have seen numerous, not just one, but numerous examples of transmission within a workplace. And that's why we have come back and said why I have been so emphatic about that need not to work sick in the workplace, because we've seen that repeatedly. The other thing is on the other strategy around that is reducing the number of people in the workplace. So going to that plea to ask people to work at home if they can, and if they can sustain the workplace. It also feeds into the reiteration of the social gathering advice, because we've seen that kind of loosening, and we've seen transmission within kind of shared households or social settings. So it's really redoubling some of those efforts. what we've also seen, we have not been seeing exploding cases. We're not seeing solid evidence. Again, we can't rule out community transmission because it takes a while before you know. But we have not seen an explosion of cases over the last week. We've seen these little pop-up cases that are for the most part already known contacts or tied into the outbreak. So, in other words, we're doing pretty well, and we've got these new recent measures or reiterations of measures in place. We have our mask mandate now in place, so I'm confident that we have the appropriate level of measures now, and we've got the lineup of what's next, or what could be next, if we are to see another surge or ongoing activity or evidence of community transmission. So always sort of continuing that proportionate response is the way that I see getting through those next few weeks and then next few months until we have a population that's vaccinated.
I'd like to thank the Premier and the Chief Medical Officer of Health and everyone for their time today. Our next COVID-19 update will take place Tuesday, December 15th at 9:30 a.m.